as Jonathan says, I'm Karen and I'm the centre head in Maggie's Newcastle, and I've been here since the centre opened over 10 years ago. As well as the stress management and relaxation and other courses, workshops and support groups, we also have a very unique service here, and that's a drop-in. So anyone affected by cancer, the person with the diagnosis or family and friends can just drop into Maggie's and get support from one of the professionals. And I think it's quite a rare thing to be able to do, particularly post-pandemic, when there is still some restrictions on what people can and can't do with regards to getting access to medical teams, etc. So the drop-in for me in Maggie's is probably one of the most important things that we do, and it means anybody can just walk in, whether they're in crisis, need advice, need somewhere to sit, just a friendly shoulder. So that's another one of the things that we do. And we're here for family and friends as well, so not just the person with the diagnosis. So I'm going to talk about supporting carers in the workplace today. And when I was thinking about how to do this, I felt it would be impossible to talk about supporting the carers without giving you some background to what the people that they're supporting go through. So the person who's had the diagnosis, to help you get a feel for actually what the carers are experiencing and living through. So I'm going to share my screen, I think, Jonathan, and get the presentation up. That not worked. Have you got the slides, Jonathan?
I can see your emails.
Yes, I know. I can see it myself. But apologies for the technical hitch. Do you have the slides?
I can share them if you want.
I just thought you were doing it. Sorry.
Okay. So I will stop that and I will share my screen. Can you see this?
Yeah.
Let me know when you can see that. Okay, great. Yeah, Karen, just tell me when you want to.
Right, thank you. So next slide. So the presentation I'm going to give is quite emotive, and some of you may have personal experience of cancer yourselves, or a loved one having cancer. So I apologize in advance if anything, if you find anything upsetting, and if you do, please do let Jonathan or myself know if you need any support after this session. So in the workplace, there are currently over 7,000 people with cancer, and because the survival rates have doubled in the last 40 years, obviously there's more people alive who've been affected by cancer, more people in the workforce, and therefore more people than ever caring for ill relatives. By 2030, there'll be over 1 million people with cancer in the workforce, and for those who choose to, work can play a vital role, but it's not without its challenges. And employees and employers can sometimes encounter barriers if the right support's not available. And again, this applies to carers. Next slide, please. %80 of carers are of working age, and approximately 700,000 people are juggling work with caring for someone with cancer in the UK. So that's a similar number of carers in the workplace as those who've had a diagnosis of cancer. There is actually an estimated 3 million people combining caring for a friend or relative with paid work in the UK. So that's taken into account people suffering from other conditions as well as cancer. In any workplace, about 3% of the employees are caring for someone with cancer. And it's not surprising that when you take into account that 1 in 2 people get cancer, then 3 in 5 people will become carers at some point. So people who are caring for someone may be working, supporting a loved one through the cancer treatment. The rest of, their usual, regular, normal activities of life don't stop. They still have other commitments. They've got children, a home to run, elderly parents maybe. Normal worries and stresses don't all disappear, and it can be overwhelming trying to do everything. Next slide, please. So I'm going to talk for a couple of minutes about what cancer actually is and about some of the treatments that people experience. Next slide. 40 years ago, 1 in 4 people got cancer. Today, it's 1 in 2. And in 15 to 20 years, the estimate is that 3 out of 4 people will develop cancer. And what it is we know cell division occurs to replace cells that have died or need to be repaired. It's called identical reproduction, and this is a normal process for us all, and it's happening all of the time. Cells normally divide in a controlled way. However, if the process is interrupted, the cells mutate and change, carry on dividing and form lumps or circulate in the blood. The lumps will be what we call solid tumours, so breast cancer, colorectal cancer, lung cancer, the ones like that. And the ones that circulate in the blood tend to be the hematological cancers like leukemia. All of these cells that form lumps or circulate have the potential to invade the surrounding tissues and spread. And there are about 200 different types of cancer, and each is diagnosed and treated in a particular way. Approximately 5 to 10% of cancers are inherited, so the rest happen for other reasons, related to various things, or just because you've actually got the potential to develop cancer. You can see on the diagram the normal cells and the cancer cells. And the cancer cells that are growing through the normal tissue are the ones that become tumours or circulate in the blood and can spread that way. Next slide. When cancers spread, they tend to become secondary. If this was an interactive workshop and you were all kind of sitting in the room, I would ask if you know the difference between primary and secondary. What primary is it's where the cancer started. So for instance, breast cancer, the primary site would be breast. If someone then developed secondary cancer or metastatic disease as it's known, or the cancer spread, it may well have traveled to a different site in the body. So typically breast cancer can spread to bones or lungs or liver, and that would be its secondary site. And if it's spread to those places, it then makes it incurable. So there are 4 main treatments used in isolation or combined and in no specific order. People can have any number of these, one of them, or, and some of them, if it's for primary cancer, ultimately there will be an end date. But if it's for cancer that's spread in secondary, they will probably continue for the rest of that person's life. So it could last for weeks, months, years, or not end until there is nothing else available. Radiotherapy is deep X-ray treatment given to treat a local area of cancer. Chemotherapy is drug treatment that travels all around the body and kills off cancer cells that are anywhere. It also kills off healthy cells, but the healthy cells can recover and the cancer cells in theory can't. However, in some instances they do, because it's not 100% guarantee. Surgery is obviously an operation to try and remove the cancer. And then we've got newer treatments, which are immunotherapies and targeted treatment. And it's very important when supporting people with cancer in the workplace and the carers to bear in mind that not all will have had the same treatment or experience during the cancer journey. And as a result, neither will the carers. So as an example, you might have, we'll use breast cancer again as an example, because breast cancer is common and lots of people get it. And I can illustrate quite sort of precisely how it might look. So you can get a lady who develops breast cancer, and it can be what's called DCIS. Doesn't have the ability to spread outside of the breast and will need surgery to remove that area and potentially no other treatment. Or you might get someone who has an invasive breast cancer. They may need surgery to remove that area. They might have the lump removed. They might have the breast removed. They would potentially then go on and have chemotherapy, radiotherapy, maybe targeted treatments and immunotherapy. They may have a hormone medication for up to 10 years. They may need reconstruction. So you can get the gist, I'm sure. One person may need to be off work for 6 weeks. Another one, having everything that's available, may need to be off work for up to 2 years. So a carer supporting someone who's off for that length of time will obviously need more support than someone who has a shorter experience. I'm certainly not detracting from the person who's only needed to be off work for 6 weeks, because wherever the cancer is, the impact of the diagnosis and an uncertain future is devastating for the person and their loved ones. But you may have someone in the workplace who has had a very different experience to someone else. And the reason I tell this story is because I remember having a lady who had been off for quite some time, and she was going back to work and was very worried about the reception she was going to get from colleagues. And partly because one of our colleagues had been off for 6 weeks with a breast cancer diagnosis, had a very different experience, and she'd already heard a couple of people saying, well, Mary was only off for 6 weeks. How come you've been off for 2 years? So bear that in mind, please, when you're supporting your staff who are caring for someone with cancer, that it can be different, even if they've had the same type of cancer. Next slide, please, Matthew. Jonathan. This is just a slide to illustrate a few of the common side effects of cancer treatment, and these occur during or shortly after treatment. And fatigue is listed there, and that can be extremely underestimated by the person with the diagnosis, friends and family, work colleagues, and fatigue can be ongoing and very, very problematic. And if you're the carer of someone experiencing this, then it understandably will take a big toll on you as well. Neuropathy is pain and burning, numbness in the fingers and toes, can affect the person, make them have difficulty getting dressed, difficulty when they go back to work on a computer. The pain can just be, intolerable for some people. They're going to have pain in the treated or operated area, loss of appetite, sore mouth, chemo brain, which I'll discuss, hair loss, alopecia, which can affect them psychologically as well, as can all of these. There's also body ache, bone pain, hot flushes. These people on chemotherapy can develop infections, become quite ill. It can be life-threatening, and they can need hospitalized. Again, obviously, this is going to impact on their relatives and carers. Next slide, please. Then we've got the subacute side effects to cancer treatment. These can happen weeks or months after treatment. And then late and chronic side effects can happen 1 to 5 years post-treatment, or last even longer, up to maybe 20 years. So the effects of a cancer diagnosis and treatment can continue for a long time after the person appears well, and again, impact on the carer. So you can see we've got the psychological impact there, body image, people have scars, they feel that they've aged prematurely. Skin reactions can be rashes, dry skin, radiotherapy burns, infections. These can happen post-surgery or post-radiotherapy. Lung fibrosis may mean there's less elasticity in the lungs. People develop a cough, shortness of breath, and this can be as a result of radiotherapy. Some people develop lymphedema in their limbs, which is fluid that remains in the affected side and can be problematic, very heavy, very painful, and difficult to use. Chemotherapy can damage the liver, the kidney, and the heart. Carcinogenesis is a new cancer due to treatment. It's rare, but it can happen. Then you've got things like the central nervous system and neurological problems. People who've had treatment for cancer can often experience cognitive changes. Personality is different. They can be quite unpredictable. Again, very difficult for a carer and can be like living with a different person. They are prone to infections because of bone marrow dysfunction. This can often happen in people with hematological cancers. Then there's sexual dysfunction, loss of libido, can lead to relationship problems. And, there's already a lot going on for these people anyway. And then if some of the patients have prostate, bowel, or gynecological cancers, they might have difficulty going to the toilet. They might have a stoma. It can be embarrassing when they're back to work, pain, diarrhea, urgency. And again, this can affect the carer because they're trying to help them deal with all of this. Then we move on, next slide, to chemo brain, which you may or may not have heard of. This is a very common term used by people with cancer to describe the cognitive problems that can occur following cancer treatment. And most of these people who have the changes are able to do everyday things, but not quite as well as they used to, which can affect their confidence, and how they feel about themselves, again, inevitably will impact on their loved ones. The symptoms can vary, most typically disappear in 2 to 4 years post-treatment, but a small percentage may last up to 10 years. Now, I have to ask the question there, if we think these cognitive changes are lasting up to 10 years, maybe we've got to consider that some of that is due to the person being 10 years older than they were when they had the cancer diagnosis. But it is a big problem, and it affects the thinking and memory, and is quite distressing. Although it's referred to as chemo brain, when I talk to people about it, I talk about it as chemotherapy, stroke cancer, stroke treatment brain, because even those who don't have chemotherapy may end up with a targeted therapy or hormone therapy or radiotherapy to their head, because there may be a brain tumor, and that can also affect their cognitive processes. And even the stress of the cancer diagnosis can cause cognitive problems. So just, the impact of the diagnosis causes stress for the whole family. Next slide, Jonathan, please. The cognitive problems that people with cancer experience are short-term memory loss. They can feel less sharp, more woolly, vague, very, very forgetful, which puts more pressure on the carer to take charge of just about everything. They have mental fogginess, difficulty with word finding. I always remember a lovely young lady who used Maggie's Newcastle, and I spent quite a bit of time supporting her. She was a top-notch criminal barrister, really, really successful, doing very well. And she struggled in a huge way with word finding, and she couldn't find the right words. And she said to me, words were the tools of her trade. She was in court, not able to remember what she was going to say, and in the end had to resign from her job and step down from, the role that she loved, because of not being able to do it anymore. And that took a toll on her financially, on her husband, her children, and her husband ended up being the main breadwinner, and because of all the difficulty she was having, caring for the family as well. People have difficulty following a flow of conversation. Visual memory is affected. They have difficulty multitasking, even women. I know I shouldn't say that. I don't know if there's any men on here apart from the two that I'm aware of, but even women have problems multitasking. And learning new skills, concentrating or focusing can be a problem. They have difficulties doing things they used to do easily, which can cause irritability. Inevitably, relatives suffer but because of irritability from the person with cancer, because they're trying to help and make things better for them. Fatigue is another problem, huge, and is underestimated by healthcare professionals, by relatives often, and by the person who starts to experience it. And I really feel people don't know what fatigue is until they've actually got it, and it can compromise them in a big way, because it's not like being tired. When fatigue affects someone, it's like, the shop closes, shutters are down, the lights are all off, and they really can't bring themselves out of it. And they feel like they're dragging themselves around trying to do things, which puts a pressure on the family. All of the above that I've described can take an enormous toll on the carer. They're coping with such a lot. What was previously a couple sharing the load, or a parent can become a carer for an adult child, or an adult child become a carer, can take a huge toll, and it's very tough. The limitations caused by the treatment-related and cancer-related fatigue impacts on everyone, and is a particularly difficult effect, and is not uncommon. Next slide, please. Now, I just want to let you have a look at these two scans. These are images of brain scans of identical twins. One had treatment for cancer and one didn't. And when people are in the same room, I often ask, do you know which one you think is the person who's had the cancer treatment? Cognitive tests were carried out to see how each brain performed, and both performed similarly. When I ask the question, often people will say, some say twin A, others say twin B. When you look at it, you can see the increased activity on twin A, all the enhanced areas. And twin A's brain is actually more active than twin B. And you could think, well, actually, this one is, functioning better. But actually, twin A is having to work much harder. So her brain is really having to work to get a similar result to twin A, particularly the frontal lobes, which are involved in the executive functioning and planning. So that can illustrate how difficult it is for these people with cancer to function as previously. And therefore, carers are having to deal with this aspect of it as well. Next slide. So, emotional side effects that regularly affect people who have cancer, there's some of them here. These same emotional side effects inevitably affect the carers. And I'm going to talk about this slide from the carer's perspective. So we'll start with, let's say, feeling a failure. People can feel helpless, that they're not doing enough for the relative. They don't know what to say. They might get it wrong. They actually do sometimes get it wrong because of the frustration and irritability of the person with cancer. They don't know what to do for the best. The person's going through traumatic treatment and the carer has to watch them and do feel helpless. Fear of recurrence is a very big problem for families. The relatives are terrified the cancer is going to come back and that they're going to have to watch their relative go through very traumatic treatment again. The fear of the unknown, there's an uncertain future for the family, partly because of the fear of recurrence and not knowing what else might happen. Humans are not very good at coping with uncertainty. We like everything to be as certain as it can be. We like a plan. I see this every day. People come in who've had a diagnosis, and if they've got the plan, they feel more in control. But if they're waiting for results, waiting for the next step, it can be extremely difficult. And, we're the same in all aspects of life. Insecure, there's nothing certain anymore. They are scared to plan for Christmas, scared to plan a holiday in case it's tempting fate, in case something goes wrong, in case the person becomes unwell. They don't want to risk the financial situation of booking a holiday in case they can't go. They can feel angry. Why us? Very tense, close to the edge. There tends to be a lot of shock and disbelief. And experiencing a diagnosis and treatment of cancer has often been likened to what the soldiers experience when they're at war. So when the soldiers are being bombed and shelled and shot at, they cope with it. And if they're going to fall apart, it tends to be once they get home and it's not happening anymore. And it's a bit like this for people with cancer. When they're literally being bombed and shelled and shot at, they tend to cope with it. And it's when the treatment's over, if it's going to be over, it hits them very hard. And then when everyone around them expects them to be happy, relieved, glad it's over, they can feel actually worse than they did when everything was happening. And that can have a big impact on the carer who was, thinking, when this is all over, we'll get back to normal. So it can be a really, really tough time. Sometimes carers feel resentment, and this is obviously coupled with guilt. So everyone's worrying about the patient. They're asking how the patient is. They're not asking about the carer. The carer can feel isolated, very lonely, left out, forgotten, guilty for feeling like this, experience a lot of anxiety. They can lose their confidence because they've got so much to do, so much to deal with. At work, they feel that they're not as switched on. They've lost a bit of their identity. And if they've been off work, they worry that someone's been doing their job. And when they come back, the people in the office will like them more than them, or they'll have done a better job because they've not been as switched on and as available. They're obviously less present. They lose their identity in their original role in the family as well, feel they've become a carer. They're no longer part of a vital, equal relationship, and have to watch their relatives suffer whilst they're trying to help, but not sure how to help. I'm going to tell you a story about a couple who used our centre, and I'll change their names. I'll call them Bill and Jean. Bill and Jean were in their early 50s, very, very successful professional couple, good at what they did, a lovely life with a happy children as well. Just they were living a good life. Very sadly, Jean got a gynecological cancer, had all the treatment for that, chemotherapy, radiotherapy, surgery, had a very tough time, coped and got through it. She then, after that was over, developed breast cancer and again had to go through more traumatic treatment. Bill was a very attentive husband, tried everything he could to help, was always there with her, and both of them were, working when all of this happened. Jean obviously had to take time off, and Bill was trying to work and help support her. And they came to Maggie's one day, and the story was Jean was in the shower having an all-time low. She was vomiting because of the chemotherapy. Her hair had started to fall out, and she was also having diarrhea from the stoma that she'd had following the gynecological cancer surgery. So you can imagine this poor lady, very, very attractive, had always been a vital person, standing in the shower, covered with hair, diarrhea from this stoma and vomit. She was absolutely traumatized, and so was Bill. She was crying and she couldn't even come out. So eventually they waited till things had slowed down and the vomiting had stopped and everything had settled to a degree. And Bill said he couldn't think of anything other to do than to get her in the car and bring her to Maggie's. By chance, I happened to meet her as she came in and saw the terrible state they were both in. I took her into a room, sat her down, and just doing my job without thinking. I didn't try and say, there, this will get better. I didn't pat her on the back and say, I'm sure, next time won't be as bad. I just said, I am so sorry that this awfulness is happening to you. I don't have words to describe how bad it is for you. And I am just going to sit here quietly with you and just have a little bit of time together. And we just sat quietly. And then as the time went on, she talked a little bit about how she feels. The reason Bill had brought her was because when she was in the shower and in a hysterical state, she said, this is it, I'm having no more treatment. I'm not going to do it. After I'd talked her through how to deal with what was happening, where to get help to reduce the side effects and speak to a consultant, get a dose reduction of the treatment, etc., she kind of started to feel a bit better. And eventually they both left in a much better state. And Bill rang me later on that day and he said, she is going to get help. She's decided she's going to carry on with the treatment. And I just want to thank you because I feel that you've saved the life of the love of my life. And what Bill's comments about the conversation were, I didn't try to make Jean feel better. I just sat with her and I said, this is awful. There is nothing I can say to make this any better. And he said that was just what was needed. And I think the message I'm trying to convey is sometimes if you're supporting someone at work who's a carer, you don't need to speak. You don't always have to, fill silences. Sometimes it's fine just to sit with them and say, I'm here, I have no words, and just spend some quiet time with them. Another little story, well, big story actually, to demonstrate how the carer feels again was just yesterday actually. I encountered a lady in the centre, again, maybe late 40s. Her and her husband were there, both working. At the minute, they're both off sick. She has had an anal cancer and had surgery, radiotherapy, very intensive radiotherapy, which you can imagine in a sensitive place like that to have cancer has caused lots of pain and difficulties with mobility. Things were just settling down and she got some new problems, had to have a scan and was told over the phone, which is quite common now, post-pandemic, unfortunately, that the cancer had spread. She wasn't told where or how much, what the extent was, but she was told she'd get an appointment with her oncologist in a couple of weeks. She didn't actually get an appointment until a month's time. And yesterday she came in here extremely distressed with symptoms as well. So in severe pain with a very swollen leg, obviously from whatever's going on with the cancer that's recurred. Mobility problems, absolutely terrified psychologically. She was told there's no earlier appointments than a month's time. And her son is also going through A-levels at the minute. And to even have some downtime and to be able to cry, she's going out to the car so our son doesn't see her. Her husband was sitting next to her with fear, worry and pain etched across his face, absolutely helpless. I managed to intervene, speak to the hospital teams, explain about this lady's recent symptoms, and I got her a much earlier appointment. When I was able to tell her she had a much earlier appointment, they both cried. But I could see how much the husband's struggling, and he is also going to be going back to work soon. So again, it's another point about the terrible difficulties for carers who feel part of what's happening, but also on the outside looking in. Next slide, please. So the psychological effects following diagnosis, around 10% of people with the diagnosis of cancer experience mental health problems that require psychological intervention. And this rises to 50% in those who experience a recurrence of the cancer. Very sadly, 58% feel their emotional needs are not looked after as much as the physical. And it's quite shocking to read that cancer patients have a 55% higher risk of suicide than those without. And I know in Maggie's, we do not infrequently get people with cancer coming in expressing suicidal thoughts, and we, work through that with them and support them at quite a high level. But how dreadful for the carer who's trying to work to have this to think about as well. Do the go to work, do the stay at home and sit with these people all day. So that is another huge impact on carers. No wonder carers experience anxiety, 67%, and depression, 42%, with over 3/4 of these not receiving any support. And my experience as a nurse of several decades is, I think this is because a lot of treatment focuses on the patient, obviously, and the carers are there, but they don't always get included in any support. At Maggie's, we do support the relatives. We recognise the terrible time they have, and it's extremely important. We see people every day come in as a couple or as a family, and they'll walk over the threshold for the first time. How are you? Oh, we're okay. And you can see they're all protecting each other. You look at them and they'll all individually have tears in their eyes. They'll often have a trembling lip. They're really not okay. And when we sit them down, get the kettle on, give them a cuppa, and to talk in more depth with them, it then becomes apparent they're all struggling. It's not uncommon for the person with the cancer to look across to his relative, his loved one, and say, it's worse for her than it is for me. I'm getting on with the treatment, but she is in a terrible state. And it can be the case that because the patient, we don't talk about patients, we talk about people, but in this talk, I'm saying patient to differentiate. The patient is busy having the treatment, being done too, and the poor carer is just observing, doing everything they can, but never quite knowing what to do. And often they'll say, I would take this away from him if I could, I would swap places. It's very common for parents of a child, an adult child, a child in their 50s, the parents will still say, I would do anything to take it away. I would gladly swap places. And then, of course, the carers often say the same. Next slide, please. So carers might find the physical and emotional demands of caring for someone very, very difficult. They may struggle to maintain the right balance between working and caring. They can experience many benefits by continuing to work, having the support of colleagues, keeps them busy, they retain some of their identity. Very recently, a teacher came into Maggie's Newcastle and her husband was very ill, non-curative cancer, compromised physically and mentally by the cancer and the treatment, and she felt she should be at home with him. However, she was continuing to work 3 days a week. She said she needed to get away to retain her identity, a sense of self, loved her job. It was a break from being no longer a wife, her words, and now a carer or a nurse. She said to me, work is who I am, it is me. When I'm at home, I'm no longer me, and my husband is no longer himself. When she was away working, which is where she wanted to be, she felt terrible guilt, worrying about her husband, worrying he'd get more acutely ill while she was out, that he would need help, that there was no one there, that she would come home and he would have died, worried she was working during his last few precious months and using precious quality time that she could have spent with him. But sometimes people just need to be away for a break, and work can be that break. I'm sure you're feeling, what a very sad situation, and this is not uncommon. So Carers have the right to ask for flexible working. They will often need that for the vast number of hospital appointments with the oncologist, the surgeon, the GP, for bloods, for treatment, for scans, for inpatient admissions. It just is ongoing. For those treated with curative intent, as I said, there will come a time when the treatment will end and the people will be, discharged back to sort of the community and being themselves. They'll have follow-up appointments, still struggle, as I've alluded to, but then there are those who have secondary cancer and will never be without hospital appointments until they're close to the end of life, and they'll be discharged into the community for end-of-life care if they're not, kept in hospital. So no wonder these people need some flexible working. They've got the right to have time off in an emergency, and they're protected by law against direct discrimination, harassment, or victimisation. And listening to this, I'm sure you're all thinking, why would anybody discriminate? But sometimes people just don't understand what these carers are going through and think, oh, they're just trying to get some time off. So hopefully, this is demonstrating just how severe their situation is. Next slide, please. So you may all know this, and I don't, want to tell people who already know about carers' rights in the workplace. So I'll just go through it briefly, but they're entitled to at least 1 week of unpaid leave a year to care for dependents with long-term needs. The Carers Leave Act has just been passed, and it's coming in 2024. But even 1 week a year that they're entitled to isn't a lot when you take into consideration everything I've said. They've also got the right to flexible working hours and time off because of an emergency, as I said previously, and there's protection from the discrimination under the Equality Act. In cases of exceptional difficulty in an urgent and with unforeseen care needs, the week of unpaid leave can be extended to more than 1 week, can be taken as an extra week, and this can be taken at various times, so not necessarily 2 weeks, one after the other. But that's still not a lot when you take into consideration what's happening to people. There are contractual rights usually found in contracts or in HR policies, and I'm sure some workplaces will have, quite a bit of discretion to help support these people wherever they can. Next slide, please. I always talk about not forgetting the bereaved either. So there's no specific legislation covering compassionate leave in the event of bereavement, and that can be up to the individual workplaces. But under the Equality Act, employers need to accommodate mental health problems that come as a consequence of bereavement. And they can say their bereavement of a child under 18 is covered by parental bereavement pay and leave regulations. But the bereaved people come back to work as well and are not always, quite fit for that. So keep an eye on those staff. Next slide, please. So a bit more about supporting carers at work. It's very important that an open and honest dialogue is kept. It's pivotal. Before treatment, on learning about the carer's relative's diagnosis, it's important to meet with an employee, discuss next steps and ask them what they need. Whilst treatment's going on, these carers will have individual needs, and you're only going to know what these are by keeping closely in touch with them. Finances are a huge worry for the person with cancer. Second, after will I die? There's research to show this, that people think first thought is when they're diagnosed, will I die? Second, how am I going to pay the mortgage and everything else? Close family will need time off work. There'll be increased outgoings, travel, parking, heating, as they're at home more. Very tough at the minute with the cost of living crisis. Things are so much more expensive, and delivering the message about reduced pay or unpaid leave can be very difficult for an HR line manager. If you have any problems like that, we have benefits advisors, as Jonathan said, in all the centres, and they can actually help with things like this. They can apply for benefits and grants on people's behalf and secure many, many millions of pounds throughout the Maggie centres each year. Post-treatment, on completion of the cancer treatment, a discussion with the carer could be had to consider any further support they might need, and keeping communications between the carer and the employer is crucial. There is research to show that 34% of people are still struggling with their physical well-being up to 2 years post-treatment, and 30% who have completed treatment in the last 2 years say the emotional well-being is still affected. Again, a big toll on the carers. Next slide, please. I'm very conscious of time, so I'm trying to get through this. This is, again, supporting a return to work if carers have taken time off. It would be, to support employees wanting to return to work through their loved one's treatment. It might be possible to offer them a bit of flexible working, reduced hours, alternate days. Nowadays, we're much better at home working post-pandemic, so that may be possible. Modifying their duties for a fixed period and reduced targets maybe. I understand, how difficult it is because there's a lot of people, as I said earlier on, supporting people with cancer and other conditions in the workplace. But you possibly, by being flexible, will get more ultimately from these people when they're in a better position to return to work. If they've taken time off sick, staged introduction to hours and tasks, work shadowing, maybe working with a buddy, possibly in a back office, as they might be too vulnerable if they're in a front-facing public role. Some people will be slower than expected to return to normal back at work and will need reassurance, encouragement, and review of their situation. It's, right to have a dedicated contact to help discuss any further support, and support is required in an appropriate, timely, and sustainable way. Some people, when they come back to work or when they're at work during their relatives' treatment, may want the situation to be kept private. Others may be happy to share. Find out how much they do want to share. And this can be very personal and individual, and one size won't fit all. It can be very wearing for a carer to be asked every day how they're doing, how their loved one is, and they need a good balance of concern and care in the workplace, which also allows them to be who they are when they're at work, because they can become consumed by the illness of the relative, and as I've said before, lose their own identity. Next slide, please. So there are some behavioural traps, and thinking back to the story of Jean and Bill, if you don't know what to say or are afraid to say the wrong thing, it's okay to sit quietly and say, I'm here. People avoid tricky conversations for fear of upsetting someone, and sometimes it's worse to avoid it than actually say something. They'll try and protect them. They'll leave someone in peace, and so they can feel that they're being left out of things, try and get a balance. They can over-plan for them, under-plan, advising, someone I know had that, someone I know had the same kind of treatment and this is what they did. Advice is very individual, and it's best not to over-advise or even, advise at all, because everybody's situation is different. People in the centre often complain of all the things that they're told. So the patients will be told, be positive, you're so brave, you're so strong, you're so inspirational. They feel people shouldn't be saying this to them because they're not feeling they are those things. They're just doing the very best they can. And carers get similar, I'm sure he'll be okay. He's a fighter, he's strong, he'll win the battle. Don't worry, he'll beat it. Have you heard about this new diet that cures cancer? Be positive. And all of this can be really, really difficult and falsely reassuring. And then, as I said previously, sharing information without consent can be difficult. Need to find out what that carer wants to be shared with colleagues. Next slide, we're almost at the end of this. So recovering from cancer is a process, not an event. The hope is 4 to 6 weeks. The reality is it can be 12 months or more for lots of people, and for others, ongoing. And if this is the recovery from cancer for the person with cancer, it also impacts in a big way on the person who's caring for this person with cancer. Next slide. Any questions? I don't know, Jonathan, whether we want to do questions after Matthew.
Yeah, we probably will. But thank you for giving us that. I'll briefly stop the screen share.
I've got main things to take away from today's session, but maybe do that last slide at the end.
Sure. I think that's good. Thank you so much, Karen, for kind of taking us through. And I think it's really important to start with the person with cancer, to get a real understanding of what the carer is going through and some of the situations that they're taking on a daily basis. So thank you for telling us that, for taking us through what a care experience is and kind of tips and ways they can be supported in the workplace. I want to hand over to Matthew to share his story. And Matthew's going to tell us about his experiences of caring for his wife whilst working as well. So I'll hand over to you, Matthew.
Hi, thank you. Yeah, so my name's Matthew. I'm here to talk about me and kind of supporting with Lindsay. I'm quite emotional after that, Karen. You did I think a really good job of setting the scene. So I apologize if I'm a little emotional. It is a hard thing to kind of talk about. So Lindsay and I actually met at work, and we've been working. Sorry guys. We've been working for, I think it was about 12 years. So Lindsay was diagnosed in October 2016. And yeah, it was a massive shock. We also have a daughter, Louisa. I didn't think I'd get this emotional, sorry, because I can talk. I talk about it quite a bit, and I think it was just kind of going through all that stuff. So yes, Louisa was 3 at the kind of initial diagnosis. And Lindsay went through chemotherapy. So chemotherapy kind of happens in a 2-weekly cycle. It's probably different for different people. And I think that one of the first things is my manager wasn't 100% sure of what can and can't be done. So I actually ended up taking half-day holidays. Because you want to be there, with them, it's a 2 to 3 hour, process of and just driving there as well. So it can be, quite a long time. And as Karen said, there's lots of appointments. There's lots of different hospitals to go and visit. So you want to support and be there as much as you can. Through that. So I think that one of the main things that I would say to managers or the HR department is to be proactive and know and decide how you guys are going to support carers, really, and to be really clear about it. So you can be upfront. There isn't a bit of deliberation there at the start, so you can kind of be clear, because really, I think as any company, you want to take the pressure off as much as you can, really, is what I would kind of say. With our company, we were very fortunate that there was a salary protection scheme of 50%. So that was really, really lucky. Unfortunately, there was a tax of about £5,000 that kind of got applied, and that was a bit unknown, so that kind of hit us a little bit left field. There is a benefit that you can then apply for, but that takes about 12 weeks to come through. We were then asking for pay slips, and that just took a little bit of time to come through. And again, I think it's unfortunate that maybe that some HR departments don't always deal with these kind of things. I think understanding that if you do offer that kind of service, to fully understand it and to help, especially in the time that we live at the moment, to say, actually be on the front foot with it and say, right, it says 50%, but actually will be potentially taxed, or there is then also these potential benefits. And again, I think because you obviously sit in your budget and you're trying to work out where you're going to be, and then to be hit suddenly with you know, a slightly different amount, has a massive effect on you at a time when you're trying to deal with, you know, children, family, appointments, and everything else that's kind of going on. Yeah, Lindsay, as I say, went through her chemotherapy cycles. She then had a double mastectomy, and then by the end of 2017 and in the beginning of 2018, she was kind of on, you know, the road to recovery. And I think, as Karen said, whilst you might think your treatment's over a 6-month period, and then obviously you go through potentially surgery, and obviously everyone's cancer journey is different. I think it's absolutely right. That first year I wouldn't say written off, but you're going to be busy with kind of dealing with, you know, treatment and going through all that kind of stuff. Unfortunately for us, Lindsay's cancer came back in the middle of 2019. So she'd been back to work. She was on slightly reduced hours. You know, our daughter was still at nursery and just starting into kind of first school or primary school. And as Karen said, when cancer comes back, and secondary cancer is then classed as, you know, incurable. So that brings a whole different, you know, mindset into it. Lindsay's primary cancer was breast cancer, and when it came back, it was inside of the lung and at the back of her neck. Generally, when it's secondary cancer and you're going through your treatment, I had to learn how to, you know, give blood thinning injections. So that was one of the things I kind of learned. Lindsay also, unfortunately, had fluid on the lung that was continually filling her lungs, so she had problems breathing. And I learned how to do a lung drain. She had a permanent one fitted. I could do it better than the nurses by the end of it, because I was doing it that often, and even putting the dressings on, which is actually quite a tricky thing because you get one shot at it. I think, again, obviously with work, we still had the salary protection. We obviously knew a little bit more and was a bit more on the front foot of understanding the support. I had a different manager, and he was very supportive, and I was able to work around, you know, more of the appointments, and he was just a little bit more flexible with me, which was a massive help, and kind of juggling, you know, helping Lindsay at home and making sure everything was kind of all right there, and attending appointments, as well as kind of, you know, still being, you know, a father and everything else, and kind of looking after my daughter. Unfortunately, in March 2020, so right at the beginning of the first lockdown, Lindsay was due to have it had progressed into her brain, and she was due to have brain radiotherapy, but it basically had just progressed too far to the point where that wasn't going to help now, and surgery wasn't going to help. So I had to drop her off at the Freeman. And again, you know, Maggie's had helped us, you know, and we visited and we'd seen Karen, and we'll play the video afterwards of you know, how Maggie's helped us at that exact point. We managed to get to a hospice with St. Oswald's in Newcastle. It's a local hospice, lovely place. And again, my manager was brilliant. Sorry, I do apologize. It is so hard. Yeah, no, my manager was great and just, you know, took all the pressure off. which is, one of the main things I would say that you can do to help. Lindsay then passed away in the 13th of April. And then again, work was really good. And, I had no pressure to, return straight away. I had a few months off, I was at home caring for my daughter. We were in lockdown. It was a strange time. So yeah, that was really, our journey. And I think with work, I think they were generally pretty good. As I say, I think that my advice would be, just be on the front foot and thinking ahead of, the things that can happen and understanding policies and making sure that managers are comfortable with what you guys decide to do as a business to support people, whether it is flexible working, whether you're able to do that, whether you're not able to do that. And I think the money side of it is obviously an important thing. And even if you go down into just, sick pay or whatever it is, to make sure that you understand the amounts where they will be, and helping them with any potential benefits or pointing them in the right direction, because really that's going to be 90% of what you can do as a company to help a couple going through or helping anyone going through, cancer or being a carer. Because they're the things that you don't want to think about. You want to concentrate on your treatment. You want to concentrate on your recovery. You want to concentrate on, everything else as much as you can, really. And I think that the last thing is we were lucky enough to have a death in service at the company that I work for. But something that you don't think about is obviously that's dependent on your final salary. And if you have reduced your hours, obviously that's going to potentially affect it. So you might want to, I'm not saying that you need to up your hours before you go off, but I'm just saying that it's something that we hadn't thought about. And it's something just to think about potentially with people or what is the policy of, can that be thought about as actually what were the hours when they were first diagnosed? So that's just another thing to kind of think about. But yeah, and I kind of half apologize for getting emotional. It's obviously an emotional subject, and it's been 3 years, and received fantastic support. I was lucky to get mental support through the NHS and the treatment that Lindsay was kind of receiving, and also be able to come into the Maggie Centre and yeah, and that's my kind of journey. Yeah, I hope that kind of helps to bring a little bit of colour and life to kind of what you guys can do and what kind of families go through.
Thank you, Matthew. That was, you really got the message across there. And I know it was tough for you, but you still got the story across really, really well. And it's the personal experience is what's the most important. I can talk about what, happens to people, but seeing you tell your story is the biggest part of this. And I was going to suggest, Jonathan, that maybe I'd talk about just some of the things to take away from today's session before we play Matthew's video, if that's all right. So just the slide about the takeaways, because it follows on nicely from where Matthew is.
Yeah, let me get back, get this back up.
So that's the one, yes. And so,
here we go.
What I want to stress is, again, there are many different types of cancer and treatment, and the side effects vary, and as I've said, can be both short-term and long-term. I think this is the biggest part of everything. You cannot compare one person in a similar situation to another, because the treatment, the diagnosis, the length of time they're going to be on treatment, or the length of time they've got to live, or whether it's curative or non-curative, can be hugely, hugely different. So it's got to be very, very individual. And, the diagnosis of the cancer and its treatments, I've only just done a very quick whistle-stop tour. I could really do this session over 2 hours if I had the chance. but the cancer diagnosis and its treatments take a huge toll on everybody. And effective communication and support for staff will lead to sustainable long-term results. It's important to make people feel supported because cancer is terrifying. Don't pressurize the individual to return to work before they're ready, because it can set them back and they can go off again. Line managers are key. Don't forget the carers, don't forget the bereaved. Research shows line managers have the biggest impact on the experience of the employee. It's good for line managers to have training to help support their staff, and obviously this is something towards that. Don't forget the line managers as well, because it can be very, very tough for them trying to manage the carer or the person with cancer in the workplace whilst doing their own job, and the experience of what they're going through as line managers, listening to these people's problems can be very tough. So to the line managers, ask for help if you need it. Don't forget Maggie's, we can help you. We can give you advice over the phone, how to work with someone experiencing these, these sort of cancer treatments, diagnosis as a carer or a person with cancer. I know in Newcastle, we have had sometimes HR line manager meet a person who they need to talk to, one of their employees who's off, either as a carer or a person who's got cancer. And if they let us know, we can, let them have a space, a nice space to do that, because they don't always want to meet at work or meet in the employee's own home. And we are here, support from our staff to support your staff, to support their staff. And that's an important thing. And there are 24 Maggies in the UK. So if you need anything from us, we're here. Thank you.
Thank you. Thanks, Karen. Yeah, it's great. We have wonderful, beautiful centres. When we do start at Maggie's, when we do work at Maggie's, we do kind of a week at a different Maggie centre. So you get a flavour of what goes on at the centres and what happens. And I did my placement at Manchester before I started working in the head office in London. And we had one guy, I remember, who just brought his laptop in and was working at, we have big kitchen tables in all of our centres. So his partner was having treatment at the hospital, but he just brought his laptop in. He was able to work in a really nice environment, knowing that his partner was close by having her treatment, but that he had kind of a separate space that was close enough where he could do his work. So yeah, you can have a look on our website. We have Maggie centres all across the UK, and they're here to help you as line managers, as carers, as if you have any questions, we're always here for you to ask. So yeah, thank you both.
The video, Jonathan.
I will do. I will do. Don't worry. Yeah. Matthew's story was featured, I think, in BBC Children in Need 2020. So that shares more about his story as well. So I will play that. I'm always very wary about playing videos on Zoom. Okay, share sound, optimize video clip. Let's go with this. Karen or Matthew, can you let me know when you can see that?
You can see it now.
Yeah.
And I'm just going to test the sound. Can you hear that?
Yeah.
Okay. I can't hear that, but I trust that everyone else can hear that.
Louisa loves dancing. I think ballet's her main passion, and I think one day she wants to open her own studio. As she tells me, that's what her dream is at the minute anyway.
This is how a ballerina sits down.
Trying to keep up with her schedule is quite a task. Make sure she's at dance and swimming and school and stuff like that.
And it's again your sister.
She's got a lot going on for an early 7-year-old.
Great.
Lindsay was a lovely, kind person. She really came into herself when she became a mum. She really enjoyed being a mum and spending time with Louisa, taking her to dance and those kind of things. At the end of 2016, Lindsay found a lump in her breast. It was cancer. She had chemotherapy to begin with, and then she had a double mastectomy after that. I think Lindsay and I just, always wanted to be open and honest with Louisa. so nothing would be a shock. And I think that really helped her when the cancer came back.
And you can just step on.
When it returned, it was classed as not curable.
By March this year, Lindsay's cancer was progressing rapidly. And as the country entered lockdown, she was admitted to the Freeman Hospital in Newcastle.
The hospital said that Louisa wasn't allowed on the ward. We were met by 2 nurses. I got Louisa to give her a kiss goodbye. That was hard.
Barely 100 metres from the hospital is Maggie's, a special place which, because of your donations, can offer a huge range of services to families facing cancer. Maggie's was closed during lockdown for face-to-face support, but for Louisa and her mum and dad, they did something remarkable.
Karen at Maggie's said that she would open the centre just for us and allowed us to come and spend a lovely afternoon together as a family.
Lindsay came into Maggie's and Louisa danced for her mum. She drew pictures for her mum. They had just a lovely, lovely few hours of family time. Not to have been able to do that would have been devastating.
It was just a magical afternoon together. It was probably one of Lindsay's last brightest days. It was, I think, just under 2 weeks after that when she passed away. I'll always have a special place in my heart for Maggie's. They were that little bit of light in the dark for us.
It was your generosity that made this possible. And tonight you can help to make sure that Maggie's can be there for more families when they need it most.
Great, fantastic. So thank you again for Matthew for being part of that campaign, for being a supporter of Maggie's as well, for sharing your story here today. I know we've got lots of comments in the Q&A box, thanking you for speaking out and sharing your story, and thanking you for kind of raising awareness of what carers go through, what your family's gone through. Great. I'm going to move on to Q&A. I know we've got a few questions, so we've got about 16 minutes or so before we close today. So I'll kind of ask some of the questions that have been put out in the chat. Lindsay asked if we can get a copy of the slides, and that's fine. I'll send a link to the slides and the recording of this session, so anyone who missed it can catch up. Someone has asked, how do you juggle between caring for someone, work and personal time for self-care, mental health, hobbies? At the moment, I'm sacrificing time for myself as there's not enough time in the day. Either Matthew or Karen, are there some tips on how to make time for all of those different things?
I think from my perspective, seeing all the people that I support through Maggie's, it's extremely difficult. It's not easy to find any time for self-care. What I would say is, if people offer help, carers often want to do it themselves and no, it's all right, I can manage. If you get offered help, take it. There's nothing to be ashamed of needing some help. If you don't get offered help, ask for help. I don't know if Matthew's got any tips. He probably didn't get much time either, because when Lindsay was diagnosed, it was lockdown and, you couldn't even take your children to their grandparents for a sleepover. It was full on, but I don't know if Matthew has any tips.
I think just, live in the moment, as you go through stuff. And I think, don't feel guilty about, I think mental health is, way more talked about even now, 3 years on, than it was 3 years ago, than it was 6 years ago. And I think I would have less guilt now, because I think you being in the right place is really, you know, as important. So try and make the little bit of time just to recharge, and then you can give your all, you know, when you need to.
And you do need to get away. Like I said earlier on, sometimes the carer just needs a break from watching the person that they love very much suffer. You need to just sometimes just get out, you know, have someone there with them instead of you. And it's also good for the person who's having the treatment to have a break from you. So try and factor in some support from someone so you can actually get away. And it makes it, you know, if you've had a break and you go back to the situation, at least you've had that time away from it. Come to a Maggie's Centre, actually. Come and have a cuppa in the Maggie's Centre. Or if you come in as a couple, you can sit separately as well. And the person with the treatment can talk to one of the staff, the carer can speak to another. We also have friends and family support groups, carer support groups here. So, you know, give us a ring and ask if we can help with anything. There's, as you said earlier on, Jonathan, there's relaxation, there's Tai Chi sessions, there's all kinds of things going on that might help you just get that bit of time for a little bit of self-care.
Right. Yes, definitely do come into a Maggie Centre. You know, there's no kind of, we won't turn anyone away. Yeah, we're able to, you know, speak to anyone. Michelle asked, we have a manager who's trying to support someone caring for a loved one with cancer. She has also had a relative who passed away a few years ago. She able to access help from Maggie's. And again, related to that, yes, there's no kind of time limit on the support we provide. Even if you have someone who passed away many, many years ago, we realize this can be, you know, a lifelong thing you're dealing with. So definitely come in if there's a Maggie's close by. And I know Adam has asked about support in County Durham. So we do have 24 Maggie centres across the UK. But we do have, I think, people who will travel to visit a Maggie Centre. So I don't believe there's a catchment area. We are based in different cancer hospitals, yeah.
Get a lot of people from County Durham. It's a little bit of a journey, but it's not too bad. And we get people from across to the northwest, so Cumbria, Workington, Carlisle, etc., down to North Yorkshire and up to the Scottish borders. So by all means, if you can get across to a Maggie Centre, ours would be the closest. But if you can't, give us a ring. We can also offer telephone or virtual support. Although I have to say, post-pandemic, most of our visitors are keen to have face-to-face support.
Definitely. And I think related to that, in the subject of face-to-face and virtual, I think Harriet raises a question. She asked for any tips for active listening and support via telephone. And I'm not sure what role Harriet's in, but a lot of meetings nowadays are conducted via Zoom, via Team, via telephone, and managers or HR professionals will be having to have difficult conversations via telephone, you know, not face-to-face necessarily all the time with the person they're supporting. Are there any active listening tips that you have, or tips for having those virtual conversations?
I mean, it is more difficult to speak over the phone or to do it virtually. But what I usually recommend to people is, if they're going to have a phone conversation with someone, to get the best out of it, make a list beforehand of the things that you need to get across. And then you'll make sure you've covered everything. And, you know, Maggie Centres, we are here as a bit of a helpline as well. So I don't know what this lady's situation is, but if she needs support or help, if she's a line manager of someone, or she's got, you know, a personal experience, just give us a ring and we can have a chat over the phone. And then we can, you know, tell her what's available and what support she can get. But if you're going to be doing anything over the phone, I think it's important to have your little list of things, because it can go out your head. It's not the same as sitting, you know, in the same room as someone.
Thanks. I know I have a question, actually, and it's maybe more for Matthew, in terms of how did colleagues react? And I know we're actually having a friendship campaign at Maggie's, talking about the experiences of friends interacting with their friend who's been diagnosed with cancer. Were there any reactions that were helpful, unhelpful? How did you kind of interact with colleagues who weren't your line manager?
It's a good question. I think I suppose I wasn't physically at work immediately after I suppose Lindsay died. I think people were supportive generally. I think the initial diagnosis, I think it goes one of two ways. You're either you talk about it or you don't talk about it. I think that my immediate team were really supportive and, you know, and asked questions. I think that when I went back to work, in my head, I wanted to do nothing more than scream about, you know, and talk about it, and people didn't. And I found that odd sometimes, but every individual will be slightly different. I think what I would say is do just talk to people. You know, generally, I think people do probably want to talk about it, but they might not volunteer it. But as I say, everyone will be different. But I think it's part of that dealing with it process. So it's better to probably offer it. And if they say no, that's fine. But if they do, then, you know, you've opened the door and you can have a bit of a chat. And talking about it instead of bottling it up is a massive mental release. Still now for me, it's a mental release. To talk about it, and, you know, this has been good for me in some ways, you know, and giving back is a massive thing as well. So yeah, I did see one of the other questions about Louisa did receive support from the hospice. So St. Oswald's had a child bereavement support there, and they have quite a few children that go there, and she had that for a year and a half or so, and she's been to a few big activities after that. And I think one of the things that we found with Louisa is we were open and honest with her, and obviously every family's different, and everyone will do things differently, but we found, you know, preparing her, that it wasn't a shock, and she understood why mummy's hair was falling out and all that kind of thing. We found to be the best way with her.
Great, thank you. And I know that there's someone who shared their experience of their son being diagnosed with Mets following melanoma. Yeah, thank you for writing it down. I know you've said in your question that you just feel you want to get it down. That's absolutely fine. If you are feeling it difficult to either talk to your son or just want to talk in general, we're here for you as well. We're always here for you to drop in and talk to a cancer support specialist, a centre head, a psychologist. And yeah, sometimes, you know, you don't need an answer, or you don't want an answer, you just want to talk and get it out there. So thank you so much for sharing your story as well. Victoria has asked, how do you manage the guilt of trying to keep everything in the air, work/home/kids, providing support to your loved ones, but also keeping a sense of normality? She says she's supporting her dad, who's been diagnosed with mesothelioma. Yeah,
I think for that, and I think I kind of was trying to say it before, it's you do look at life slightly differently, I think, when you're going through that. And I think living in the moment, I think it's about taking that time and making that space. And, you know, even if it's half an hour to go for a walk, me and Louisa, we walk to school. It's one of my happiest times of my week, is getting out in nature. You see the difference of trees and plants, and I know it sounds a bit silly, but it's just, I think making space mentally, as I say, will help you massively. And I think it's very easy, I think, and I think we used to do this a long time ago, like just keep head down, get into it. I'm just going to keep caring. I'm just going to be there for my dad. I'm going to be there for my wife. I'm going to be there for my children. And you get to burn out, and we have our worst behaviors at that point, don't we? And I think actually there should be no guilt, because your mental health is equally as important as someone's physical health. and, you know, absolutely don't feel any guilt.
And I would say get some support from somewhere for yourself, because it's a lot to carry, all the juggling and trying to be there for the person who's ill. And I think because of the pandemic, we've become so much better, even though, as I said, we do a lot of face-to-face support, better at virtual. So you can, doesn't matter where you are in the country, you can get support from somewhere, any Maggie Centre. There's other organisations as well. But as Matthew says, you know, don't feel guilt, but we all feel guilty all the time. Everything we do, it's, oh, well, I should have done it better. And remember, you're doing the very best you can. And see one of our psychologists, speak to one of the cancer support specialists. So there's 3 of us in Newcastle. We're all nurses by background, but with a high level of emotional support, training and understanding, and just get yourself in touch somehow with whichever one you want to get in touch with, really, centre-wise, and we'll do everything we can. There's other courses, there's mindfulness courses, there's stress management. It's imperative that you get help for yourself so you can continue to do what you're doing, but it is not easy.
Thanks. And I think one final question maybe before we close. Does Maggie's offer support post-bereavement to families and children, even if the service hasn't been accessed before?
Yes, we run bereavement courses here, bereavement groups. We have one-to-one sessions with the psychologist for people who've experienced complex grief. So it's been a very, I mean, all bereavements are difficult, but a very complicated set of circumstances. We don't routinely do bereavement support for young children, but as Matthew said, the hospices do. But our centres also run family days, children's days that you can come along to. We've got one going to take place on the 1st of September, and that's for children whose parents have cancer or had cancer. So there's services out there, but lots of bereavement support in Maggie's and also hospices.
Great, thank you so much. That's amazing, and you can find that out on our website. So if you visit maggies.org, all of our centres will have their own individual page on our website where you can find out the complete table of what's happening, so you can see what services are local to you. Do either of you have any final words before we close? I think it's been a really good session. There's been so much rich discussion and experiences shared, and I think everyone will come away feeling that they've learned something or something that will stick in their mind for sure. So yeah, any
yeah, I hope people have found it useful, and I'm feeling a bit better, a bit less emotional than I did at the beginning. And as I say, just be if you're a manager or HR, it's just being as proactive. I know that sounds like the most obvious thing, but you know, being as helpful, proactive, taking as much stress out of the situation. And if you can even just give one thing to say, you know, being ahead of the game, ahead of the curve, will massively, massively help and make a massive difference of taking a little bit of pressure out of an already very pressured, very difficult situation.
Thank you.
Thank you, Matthew. And I would say, remember, we're here for you to help in any way we can, whether it's a family member or a colleague, you know, get in touch if you need it. And reiterate what Matthew said about, you know, supporting the people at work. And also just a huge thank you to Matthew, because I know it was a very, very difficult thing to do, Matthew, today. And you've, you know, really demonstrated how it is, illustrated to have been in your situation. And I would also like to say Matthew's done an incredible job with Louisa. She's a beautiful, well-adjusted little girl.
Thank you.
The image of her mum. And she sometimes comes into the centre with Matthew, and it's always wonderful to see her. And when she comes in, given what happened in here when her mum was ill, she's just at home in Maggie's, and has got the confidence to come in and did some fundraising for us with Matthew. And it's always such a pleasure to see them. So thank you, Matthew, for sharing.
You're more than welcome. Thank you.
Thanks everyone. And yeah, definitely, I know it's been an emotional session, and thank you, Michelle. I'm glad it's been useful as well. But yeah, take some time out to reflect and to process and to yeah, decompress if you need to take a lunch break. But yeah, we will send the recording around. If you do have any questions, please do reach out to your local centre. Thank you again. Thanks, Matthew. Thanks, Karen.
Thank you. And yes, we do offer support even if you haven't used Maggie's before when there's been a bereavement. So I think I didn't quite answer that. So thank you. Bye.
Thank you. Bye-bye.